September is Pulmonary Fibrosis Awareness Month, and Dr. Amy Hajari Case is here to explain more about this disease and what's being done to find a cure. Doctor, thank you so much for joining us.
Thank you for having me. It's
Pleasure.
great to be here.
Yes, pleasure to have you here. So explain what pulmonary fibrosis is and why is it important to know about this disease?
Absolutely. So pulmonary fibrosis is a disease process that affects the lungs, so pulmonary, and fibrosis is a word that means scarring. So pulmonary fibrosis leads to scarring in the lungs that then leads to coughing, shortness of breath, and symptoms of breathlessness and fatigue and things like that. It's important to understand and know about it, be aware of it, because the symptoms are a little nonspecific. They can be attributed to many other things, heart disease or other types of lung problems. And so if we don't think about it, if we're not aware of it, then people can have a delay in their diagnosis and then a delay in treatment. Treatment options are available, and they can slow down disease progression, can help people live better, have better quality of life, and control symptoms, but only if we have a good diagnosis.
Absolutely. And do we know what causes it?
So there are a number of causes of pulmonary fibrosis. Some we don't really have a good handle on the exact specific diagnosis, specific cause, and so we refer to those as idiopathic types of pulmonary fibrosis. Many types of pulmonary fibrosis are caused by autoimmune diseases like rheumatoid arthritis or perhaps lupus, and then our environment can cause injury to the lungs and can also lead to pulmonary fibrosis, things we're exposed to in the workplace or in the home environment.
Okay, and now we have Pulmonary Fibrosis Awareness Month. Tell us what happens during the month.
Sure. During the month of September, we're all out raising awareness about pulmonary fibrosis. It's important to do so that people can get an earlier and accurate diagnosis, and that we push forward with research that will lead to better treatments and eventually a cure. So this year, our theme is Every Breath, Every Story. And we're asking members of our community to share their stories on our social media channels. We're sharing 30 facts in 30 days, also across our social media channels. We have our Blue Up for PF campaign, where landmark buildings and monuments across the country will light blue at night to show their solidarity with our PF community. Okay. And then we also have our walk program with large walks in Chicago and San Francisco, as well as National Walk Day, where people can walk in their own communities on September 28th and help raise awareness and funds for educational programs and research into pulmonary fibrosis.
And doctor, just really quickly, how can people get involved and help?
Sure, Sasha. I would encourage everyone to go to our website at pulmonaryfibrosis.org. They can find out more about pulmonary fibrosis, our educational programs, find a support group or medical care where they can receive that important diagnosis and treatment. And if someone you know and love is dealing with respiratory symptoms like persistent cough and shortness of breath, I would encourage them to see a pulmonologist and get a diagnosis.
And be proactive. Dr. Hajari Case, thank you so much for being here.
Thank you for having me.
Appreciate it.